many questions about the coronavirus, and that's why we've started a new segment here on CBSN Denver. It's called Q&A with Dr. Dave, and joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, we've heard so many stories of people who have had coronavirus but have shown no symptoms. How is it possible to catch the virus from them?
Really, the biggest concern is when you look at the actual numbers, we think that about 1 in 4 people who have been infected with coronavirus have no symptoms. And these are people who are potentially contagious and can wind up giving coronavirus to you, even though they feel well. And the biggest issue with this is how could they possibly make you ill if they have no symptoms? Well, you have to kind of think about the mechanisms here, and the mechanisms actually boil down to something pretty simple. And that is, every time someone speaks, they wind up having very small little micro droplets of saliva wind up coming out of their mouth. And that can travel airborne a distance, or people wind up touching their mouths or nose, and then they wind up touching a surface. And then the next thing you know, you go over and you touch that surface and you wind up picking up the germ. So it winds up going from someone who has no symptoms whatsoever to giving you symptoms. And the next thing you know, within maybe 14 days or less, you wind up becoming sick and you never even knew you were in contact with someone.
And here in Colorado, we've seen outbreaks at meat packing plants like JBS and Cargill. Is it safe to eat meat when plants have had workers who are sick with coronavirus?
This is a tough one because when you look at it, there are more than 10,000 workers who have been infected or quarantined nationwide because of coronavirus. And so obviously your big concern is for them and for their families. And then other people, say there could be a problem with the food chain and food supply in the United States. Having said that, when you actually look at the food that is being produced, the meat and the poultry that are coming out of these plants, we don't think that there's a big problem with that. And the reason for that is twofold. First off, when you get meat or poultry, you need to cook it up. You don't eat it raw. And the temperatures that are used in order to cook things like poultry or meat are more than enough to kill the virus. The second thing is, even if you wound up ingesting the virus, the stomach acid in your body would wind up being so harsh that it would kill the coronavirus germ. That's been tested in the lab. And so we don't think that there's a direct problem with eating foods that are coming from these plants. On the other hand, you need to go back to the ages-old problem that we worried about, and that is not COVID, but things like salmonella and other sources of food poisoning. So you got to keep this in mind. When you are doing food prep, you need to use good hygienic practice, good hand washing technique. You have to make sure that you're cooking your food thoroughly, and you can't cross-contaminate, for example, using the same platter for raw food versus cooked food. So the bigger concern here is actually the older ones. It's more food poisoning than it is food safety from COVID.
And pot shops have remained open during stay-at-home orders. How could coronavirus affect people who smoke marijuana?
That's a tough one because when you actually talk to medical professionals on this one, the universal answer to whether it's safe to smoke marijuana right now, the answer is no. And there really are 2 reasons for this. And we know that it can wind up not only just increasing your risk of catching or becoming infected with coronavirus, but if you do become infected, your complication rate winds up going up higher. Now, why is that? The reason actually has to do with the particulate matter in smoke. You wind up inhaling marijuana and it winds up going into your upper airways as well as your nose and throat. And the normal cells that live in your nose and upper airways do a really good job normally in terms of pushing bacteria and viruses out as well as just keeping up a good immune function. The problem is when you smoke, you wind up paralyzing those cells. And so germs, particularly COVID, can wind up getting a foothold in your nose and throat as well as upper airways. Now, the same thing obviously goes for things like vaping and cigarettes, same theory, except with marijuana, you tend to have a little different style of smoking, perhaps. You wind up inhaling longer, you wind up inhaling more deeply. So even if you just have a little bit of marijuana, it is the equivalent of smoking more than a pack a day.
And so many people are doing everything they can to avoid getting COVID-19 by wearing masks, washing their hands, and of course, social distancing. But are there any vitamins or over-the-counter medications that could reduce the risk?
Yeah, it's kind of an interesting thought because the way this whole thing has worked is researchers have literally tried to study a lot of common medications that are available over the counter. For example, they have taken 13,000 compounds and some way or another mixed them with coronavirus to see if they could stop the virus from multiplying or replicating. And this includes things like antihistamines, stomach acid reducing medications such as Pepsid, even dextromethorphan, a common cough syrup, has been studied. And unfortunately, none of these things have really shown much promise. Now, in a hospital setting, when you take a look at things like vitamins, certain vitamins may be helpful. For example, higher doses of vitamin C, vitamin K, and vitamin D. But experts don't think that if you wind up taking this in large quantities over the counter, you're going to wind up, number one, helping yourself. And there's a possibility you could actually have issues with some of these over-the-counter vitamins and minerals, literally overdosing on some of them as you try to keep yourself healthy. That's not to say something like a multiple vitamin is a bad idea, especially if your nutrition is not as good as you'd like it to be. But unfortunately, when it comes to things like vitamins and minerals, there is no magic bullet that is going to keep you from getting sick. The things that we keep on talking about, social distancing, wearing a mask, lots of hand washing, those are the things that we have found to be the most effective way of preventing yourself from becoming infected with coronavirus.
And Dr. Dave, thank you so much for all of that helpful information. We certainly appreciate you. And we're going to see you back here next week as we answer more coronavirus questions. And to read Dr. Dave's latest blog, just visit cbsdenver.com. We'll be right back.